pregnancy is a joyous occasion for most women and their families. However, it can also be a time of great stress and concern. Many women wonder if everything is going as it should. For most women, the reassuring sound of a heartbeat is the first sign that everything is fine. For others, however, a heartbeat may not be detectable. For example, a woman who is expecting twins might not be able to hear the heartbeats of both babies at the same time. Heartbeat is the strongest and most reliable sign of pregnancy. When a woman is pregnant, the heart starts beating faster and in a more powerful way to support the growing fetus. The heartbeat can be heard during the doctor's ultrasound scan. The heartbeat can be heard with a stethoscope or through the mother's abdominal wall. When do you get a heartbeat in pregnancy? The best time to hear your baby's heartbeat is at about 5 to 6 weeks after conception. In fact, it's the only time you should be able to hear it. The heart starts as a tiny flicker of a heartbeat, with a few beats per minute. At this stage, the heart is still in the same place as the rest of the developing baby, in the abdominal cavity. Doctors recommend that you have your first prenatal appointment about 6 weeks after you have a positive pregnancy test. The doctor will either do an ultrasound or take a blood test at that appointment to make sure your baby is growing normally. Hearing your baby's heartbeat is also a great experience. How a heartbeat is detected in pregnancy. A baby's heartbeat is detected between 6 and 8 weeks of pregnancy, but how is it possible? During the first week of pregnancy, the embryo is just 0.17 centimeters long. How can doctors detect a heartbeat in such a small embryo? It's actually easier than you might think. The embryo's heartbeat is detected using an ultrasound transducer, a device that uses high-frequency sound waves to create an image of the body. The transducer is placed on the mother's abdomen, and the sound waves travel from the transducer to the embryo and back. A computer turns the sound waves into an image of the embryo, and the heartbeat is represented as a blue line on the image. The number of heartbeats per minute can be calculated from the image. How much heartbeat is normal in pregnancy? In normal pregnancy, the heart rate of an unborn baby ranges from 120 to 160 beats per minute. The heart rate is usually higher in the second trimester and can reach as much as 180 beats per minute. A heartbeat that is much faster than usual can be an indication that things are not going well. Most women can hear the sound of their baby's heartbeat with a handheld Doppler device, which is available at most major maternity stores. The sound of a baby's heartbeat is quite distinctive, and the rhythm is usually steady. Most women recognize the sound of their baby's heartbeat right away. If you are unable to find your baby's heartbeat, contact your doctor right away. Can you still be pregnant with no heartbeat? A pregnant woman can technically still be pregnant even if there is no heartbeat present. The truth is that being pregnant is not defined by a heartbeat. It is defined by the presence of a fetus in the uterus. A fetus is an embryo or unborn baby, which is about the size of a kidney bean at this point in the pregnancy. This is important to know because the embryo or fetus is actually what causes the changes in a pregnant woman's body, not the heartbeat. The heartbeat is simply a sign that the pregnancy is progressing. If a woman is experiencing pregnancy symptoms, such as morning sickness, then she is definitely still pregnant.